Reversing a diagnosis and staying healthy can be very difficult, especially when using natural remedies. Also, especially because usually we are advised and encouraged to take the easy way out. Or those of us in the predicament sometimes simply want to take the easy way out and are not willing to consider natural remedies, which don't have any side effects. But the thing is, the process requires diligence, consistency, momentum, and to a degree, a certain level of discipline, especially in a world where everything is made fast and easy. Our guest today is one Kim. He works in finance, but he's really been studying natural health in detail ever since he learned about his wife's diagnosis in 2023. One, thank you for joining us.
My pleasure. Thank you for having me.
Definitely. I have so many questions, but can you briefly share your story before the diagnosis?
Sure. I mean, I was working in finance. I've been working in finance for most of my career, working life, and I didn't really have much interest in healthcare or natural health. I mean, I did sometimes stumble across articles that would say certain natural ingredients are really good for the body. I actually smoked cigarettes for many, many years. I was always kind of scared, like, oh my God, what am I doing to myself? Eventually, I was able to quit smoking, but I do have this concern that I may have caused some damage. So I guess that's
Hmm.
probably why I was always keen on certain articles that would pop up on my feed that was interesting to me that I may have remembered. But that was really my background in health before any of this happened.
Wow. If you don't mind me asking, what type of cancer was your wife diagnosed with, and at what stage was she?
So she had a lump in the breast for many years, but it had been diagnosed as being a benign tumor, so she wasn't quite worried about that. But one day she said that I think it might be getting bigger. Maybe we should get that checked out. So we went and got checked out. The radiologist that they explained to us, she has benign tumors on both sides, both breasts, but theirs is this really, really small growth, 6 to 8 millimeters they're concerned with, and they want to make sure that she's protected. That's the phrase she used. We want to do a needle biopsy today. So we said, okay, go ahead, do the needle biopsy. About a couple weeks later, we got a call explaining to her that she has what's called a invasive ductal carcinoma of the right breast. So it is what they call a cancer. It's in the duct, not in the lobules, but it's invasive, meaning it's come out of the duct slightly. That's what they mean by invasive.
It's a lot of words you're speaking that I do not understand, but that must have been very serious.
Yeah, I mean, we heard it, and for some reason, immediately we're trying to book an appointment with the surgeon
Hmm.
and go and see him and see what we can do. So it was a bit of a shock, but I don't know. In the back of my mind, I was preparing for it already and looking up medicinal mushrooms, all different kinds of medicinal mushrooms. I had ordered a whole bunch, and we were taking them every day just because I wanted us to be healthy anyways, and I was hoping
Okay.
that we were going to get good news that there's nothing wrong, and it didn't hurt to take things that are healthy for the body. So I had a head start, in a
Wow,
sense.
that's
Mhm.
amazing. But what was your initial reaction to the diagnosis?
Kind of hard thinking back now because now I feel so confident about everything, and I remember just thinking, we can get through this. There's a
Right.
way out.
So, what led you to choose natural remedies over conventional treatment or
Sure.
alongside conventional treatment?
So I guess my very first experience ever with cancer is when I was very, very young. One of my uncles got diagnosed with cancer, and then he passed away sometime after that. And this was many, many
Mhm.
years ago. So my understanding is this is a very serious disease. It's not
Right.
easily dealt with. And over time, I realized there's a lot of research that goes into it, supposedly, and that we don't have a cure for it. But as so many years passed, I figured that medical science has made so many advancements that we could probably, in most cases, treat people and help them. And I did hear situations where people have been diagnosed and they've gone through procedures and they're doing well now. So in my
Mhm.
mind, oh, it's got to be something that we can handle. But what happened
Right.
was a couple years before all of this, one of my wife's friends got diagnosed. He actually passed away. And
Oh
he went through
no.
all the treatments, all the rounds, and I figured they're gonna take care of him. He's gonna be fine. So he did all of the treatments and went into remission. Then it came back with the vengeance, and then it spread.
Mhm.
And then I spoke to him kind of like on a Zoom call like this, a video chat like this, and he was speaking and he was in good spirits. And I had sent him a package with some omega-3, grapeseed extract, medicinal mushroom extracts, because I just read some articles that they're helpful, and I was pretty positive that it's going to help him. But I didn't realize that he already checked into a hospice clinic. He paid 2 months worth because they pretty much told him to get your things in order, and he didn't tell me about this. My wife didn't explain to me. He just seemed perfectly
Mhm.
normal to me. 2 weeks
Yeah.
passed, and because of all the medicine they were putting into his body, he couldn't communicate anymore, and then he was gone. So I guess that I didn't want to lose my wife, and I
Right.
realized that I can't chance this. I gotta take control, and we gotta do everything that we can do. I'm not gonna allow other people to tell me what we can and cannot do. So that's why I decided I'm gonna look into things. I didn't know what it was going to be, but I'm gonna
Right.
definitely look into it. Yes.
Were there specific natural therapies or philosophies that influenced your approach?
Sure. I mean, I guess the very first thing we did after meeting with the surgeon is just out of curiosity, trying to figure out what's out there in terms of information. And I don't know, I must thank Amazon's AI or Google's AI. I feel like I got really, really lucky and started reading really, really good material. The very first book I ever read was called Cancer Cured by an author called Mark Sloan. It's actually a book that combines two of his books. The first
Mhm.
one is really talking about the cancer industry. The second one's talking about his experience losing his mother to cancer. And he
Mm.
talks about so many topics, but I ended up listening to both books on audiobook. And then I ended up buying the combined paperback. But what's so wonderful about his book is that he actually cites 2,300 scientific and clinical studies. So it's not just hearsay, but this has so many scientific writings that is very
Right.
informative. So it's not like I'm practicing some kind of weird, unsubstantiated
Mhm.
practice, but this is all backed by science. I just want the audience to know everything that I do is evidence based and science backed.
That is definitely good to know.
Mm,
Because sometimes when you decide to take the natural approach, it is
mm,
assumed that you are just trying things or doing things rather
mm,
than you have done your due diligence and are
mm,
really trying to get out of the predicament that you are in, even
mm.
though medical professionals are telling you that you cannot. So,
Right.
yeah, that is good to know. Did you consult with a healthcare professional or professionals about your decision?
I mean, we met with doctors and they would tell us their professional opinions and we would listen to them.
Mhm.
And they basically told us you should do surgery, get it out of there as soon as possible. You have a choice of doing a lumpectomy, which means just removing the little tumor. But if you do the lumpectomy, before we do that, we want to do all kinds of scans. We want to do MRIs. We want to do additional biopsies. The MRI, by the way, is very, very sensitive. So it's going to pick up a lot of things and we're going to end up doing a whole bunch of biopsies. Most of the time, the additional biopsies are going to be nothing, but you're going to have to kind of put up with that. Once you do the lumpectomy, you're going to need to do radiation for a month. So 5 days a week for a month. And he explained it as we're using the energy of the sun, we're putting it localized into the breast tissue. And studies show that over a 5 year period, if we do this, the likelihood of recurrence is diminished considerably. So that's another way to do it. The other option he said is to do a bilateral mastectomy. That means removal of both breasts. And he said we can conserve the nipples, and then you can also choose your own plastic surgeon who will be.
Wait,
Mhm.
wait, you can remove the breast and conserve the nipples? How does that work?
I think they just remove all of the tissue inside of the breast, but they conserve the nipple. They don't remove the nipple itself. If the cancer
Oh,
has not spread to the nipples, they'll save the nipples. So, and he said you can pick your own plastic surgeon. I'll give you business cards. You can interview them, choose the one you like, and that plastic surgeon will be in the operating room and will do reconstructive surgery on the breast. It takes like an overnight stay, I think. It takes a few days. At first they put in something called a tissue expander and then put
okay.
the implants in later, so a person can choose to have it all done at the same time or over time. And so
Mhm.
it sounded kind of scary. And
Yeah.
the surgeon, who's super nice, he's like, Are you leaning any particular way?" And
Hmm.
I've been in finance my whole life, but I've also been in sales my whole life. And I kind of understand when somebody's presenting options, but
Mm,
to me, it felt like you have this one way to go, the lumpectomy, the small surgery, which involves some other uncomfortable things you have to deal with, but it's still good for you. You have this
mhm,
other bigger surgery. If you do that, you don't have to do all the additional biopsies. You don't have to do the extra MRI guided biopsy. You don't have to do radiation. We're just going to take everything out and make it look beautiful. So I think that a lot of women may be in that situation. I imagine they're very scared and they're being
right.
presented with two options. And to me, as a person who's been in sales, it sounded like one was meant to sound better than the other. So
Okay.
that was my impression, like, and then asking which way are you leaning towards? How would a woman be leaning one way or the other? I was thinking you're in shock, you don't know what's going on in your body, you're all scared, and they're telling you choose
Yeah.
one path versus the other. So I thought that was a little bit interesting, and I didn't like it. I kept my mouth shut, but I didn't like that part.
I can't even imagine because
Mm,
when you're in a condition like that, you just think of what can I do better to get better? That's
sure.
all you think about. So to be given options, I guess that's the only way out for them. Those were the only options as professionals that they had to present. But it kind of is a little disturbing when you think about it. You have to choose an option as to how you want to lose your breast. That's something. So can you describe the natural remedies or lifestyle changes that you used during this
Sure.
time?
Sure. So, I mean, I started reading so many books, started reading so many medical journals, papers, watching lectures, videos. Probably gone through 50 plus authors by now who
Wow.
collectively cited thousands and thousands of papers. And we're talking about Nobel Prizes in the research that's been done. This is not a mystery. People who are amazing have done the work already for us. It's just that
Mhm,
it hasn't been adopted by the system, the healthcare system, which I have heard being referred to as the sickness management system as opposed to healthcare system. So
mhm,
some of the practices that we've used immediately were to change our diet and lifestyle. And so we stopped eating things that are not good for us. We are avoiding trans fat. We are trying not to eat things that metabolize as sugar, refined sugars, refined carbs. Those are the things we cut out right away. We also started doing intermittent fasting. And the reason we did intermittent fasting right away is because cancer cells produce something called nagalese. Nagalese is also produced by viruses. And what nagalese does is to put our immune system to sleep. So we have something called macrophages, which means big eater. And they're kind of like Little Miss Pac-Man. They go around, they gobble up pathogens. But when viruses or cancer cells produce nagalese, it lowers something called GCMAF. And if the GCMAF is lowered, then the macrophages don't really do their job. And so that's why we get sick, is because the macrophages, the little Miss Pac-Man that's supposed to go around and do her job, is no longer doing her job. And so when we do fasting, it helps increase the GCMAF. It helps
okay.
activate the immune system, makes our body stronger. And this is how we can prevent cancer from spreading very quickly. They call metastasis. And yes, so that was one of the first things we adopted was the
Okay.
fasting.
And if you can elaborate a little bit more, what is the GCMAF? What is that?
It's an enzyme that's necessary for our macrophage friends to protect us from
Right.
pathogens that come in the body.
So, how did you discover or learn about these remedies? Was it just through research, curiosity? How did you discover or learn about these remedies?
It was just all curiosity and reading and watching, and one thing would lead to another. I would read one book and be fascinated and think, oh, I got to find the next book to read because
Yeah.
I was scared at that point too. All the stuff sounded really good and convincing, but it was just one book. So then I had to find the second book, the third book, the fourth book. So I kept reading and reading and reading, and all of them were saying things that are very positive, and sometimes they would corroborate. A lot of times they would corroborate each other, and sometimes I'd read a book that had nothing to do with cancer. It was talking about health, but it would tie everything together, and I had aha moments. Well, that's why that's good for the body. That's why that worked. So
Right.
it was very interesting.
And usually, I guess that's how it works because I believe that everything that happens in our body is
Mm,
connected in one way, shape, or form.
mm,
So, the more you discover about chronic diseases and other diseases and our health, our way of life, our lifestyle, it all kind of connects and makes sense, right? So, did you face any challenges or doubts during this journey?
Yes, I had some doubts because I mean I hear testimony of people who had late stage cancer that they were supposed to just pass away, but they went on a lifestyle change. They did fasting, prolonged fasting, and they're
Yeah,
talking about these great results they've had where their tumor has shrunk considerably over 21-day fast. And so
yeah.
we didn't do 21 days. We gave up after 8.5 days. Well, I gave up after 7.5 days. My wife went 8.5 days. But
Wow.
what we had so many ultrasounds because the doctors kept trying to get us to do the surgery. And we kept trying to say, oh, we haven't decided yet. We haven't decided yet. And they would put in their notes, oh, she's not mentally ready to have the surgery. And I would be
Yeah,
reading these notes. It's not that we weren't mentally ready to have the surgery, we just didn't want to have the surgery.
yeah.
But we didn't know how the doctors would react if we told them we don't want to do the surgery. So we couldn't really have that open discussion with the doctors.
Yeah, that is so interesting for you to say because a
Mm,
similar thing happened to me on my journey when
mm,
I decided to use natural remedies. And I know cancer and diabetes are two completely different things and
mm,
come about in two completely different ways. But it is
mm,
amazing how many a time there is this pushback when you try to use natural remedies that can actually help you. And it's very interesting that you're talking about this because I use fasting a lot during my journey, even though I haven't talked about it a lot yet. And currently, I'm on day number 8 of fasting that I'm doing. I'm trying to push myself to see how long I can go. So it's however long I can go with a water fast, and I'm on day number 8. It is amazing how beneficial it is. And again, we are not asking anybody to go on a prolonged fast without supervision because
mm.
it's a personal choice and you have to decide what you want to do and how you want to do it. But it is amazing how fasting is really talked less about, sometimes even bashed into saying that it is not a good thing when it is actually one of the things that helped me reverse every single chronic condition that I had. And even the doctors are blown away by the changes and the transformation that occurred in my body. So
Yes.
thank you for saying that because that is a very vital point that I think is not emphasized at all.
Mm.
So, were there any particular remedies or approaches that you feel were most effective?
Yes, so aside from the fasting and the change to the diet, I thought that high dose vitamin C by intravenous injection was very, very helpful. Why did I feel it was very, very helpful? Because the gentleman who did a lot of research on it, Dr. Linus Pauling or Linus Pauling, he has two more Nobel Prizes than I do. And I don't have any Nobel Prizes, by the way, but he received two Nobel Prizes. He's the only human being to have ever received two Nobel Prizes. He received the Nobel Prize and then he received the Nobel Peace Prize. And when I say he's the only one who's received those two, normally when a person receives a Nobel Prize, they receive it with other people, but he received them by himself on both occasions. He's the only one who received both kinds of Nobel Prizes, and he didn't share the award with anyone else. And he did research on high dose vitamin C intravenously and the benefits that it had on cancer patients. And that's why he won the Nobel Prize. Now, interestingly enough, a decade later, there were studies done by another institution which said that the vitamin C was useless, so to speak,
Oh, okay.
and that it wasn't even good enough to treat the common cold. But the difference between the two studies were that the second study used very low doses. They
Okay.
administered only orally, not intravenously, and they would test the vitamin C levels, I think, half a day after the administration. So, to me, as a person who's just logically thinking about it, the second study is almost trying to disprove something by not giving it a chance. And
Mm,
so that was something that I noticed. But vitamin C has had hundreds and hundreds and hundreds of studies, and it's been redone recently in the recent years on its effect on cancer cells. So I
yeah.
figured this is something that I could really feel more comfortable with. So that I like that part in particular in the
Yeah.
beginning. Yes.
How did your family and friends react to your choice? And I'm asking this because I remember during my series of chronic diseases, aside diabetes, I had herniated discs in my spine after I had my fourth child. I don't know what caused it. Whether it was the epidural, whether it was, nobody could give me any answers. But I had three herniated discs in my spine where I could go days and days without being able to get up and walk. I could be bedridden for 7 days, 8 days.
Yeah.
Even when I needed to go pee, TMI, but somebody needed to help me
Sure.
to go use the restroom. And it was so bad. But I can tell you for a fact that after changing my diet, and the only resolution was surgery. And like you and your wife, I didn't want to have surgery. Surgery had to be a last resort for me. And I get it
Sure.
that some people don't have a choice, but for me, I felt like I had a choice. Aside the lifestyle changes and the nutrition and the diet that I changed, I use fasting again, and till this day I don't feel a thing in my spine. The last time I went for a test, I was told there were no traces of
Sure.
herniated discs in my spine. But when I was going through this journey, my friends and my family, especially my family, they were very skeptical.
Mm.
It was like, okay, you can't get up and walk, you can't do this, you can't do that, you are a diabetic, at the stage of a diabetic coma, because my doctor
Mm.
couldn't even believe I was walking around. They were so concerned that
Yeah.
for them, it was like, okay, just get it done already, have the surgery, just get out of this situation, get yourself out of misery.
Mm.
So, how did your friends and your family react to your choice?
A good question because I feel like the people that I spoke to, they were very supportive. I
Wow.
remember they're very supportive and they told me, well, I hope it all works out. If it works out that way, what would be better than that? Healing naturally without doing anything invasive. But I mean, I do hear things from time to time. People might be nice to us and say, oh, that's wonderful, that's great. But there's the other side of it. They could turn around and go, that guy's crazy. They were
Yeah.
crazy, right? So I accept. Even people watching this video are gonna say those people are crazy. Well, we just have to accept that not everyone's gonna be on board. Some people think a certain way. They have a certain paradigm. They believe when something goes wrong with the body, we need to put the onus on other people to tell us what to do. We don't want to take responsibility and say, what can I do in my life to make my
Mhm.
body better? I would
Mhm.
rather go to someone else to let them tell me what I could do.
And I guess everybody has a choice, right? So
Yes.
what works for you works for you. Okay, so
Right.
did you join any support groups or communities? Because one thing I didn't do was
Mhm.
join a support group. I don't know why, but did you have the urge to join a support group or community?
Yes, so I did it right away. So at first I was reading books and I was pretty sure I was on the right track. But the reason I joined the support group wasn't for my wife or for me, so to
Mm,
speak. It was for a friend who had a different diagnosis altogether, and I didn't
mm,
know enough about it because whatever I was reading wouldn't specifically talk about that particular type of cancer.
okay.
And the person was diagnosed a few weeks after my wife received her diagnosis. So
Mm,
and before he found out and he was telling me about all the symptoms and what the doctors have been telling me, all the tests are going to run, I pretty much knew he was going to tell me he has cancer because of the readings that I'm doing. But it was really more to figure out how do I help him. So I
mhm,
joined a group that was meant for people going through that diagnosis. And I try to make friends with the admin. And then I try to share some of the readings that I've gone through about becoming healthy. And then the next thing I knew, I was being censored in that group, and the admin
oh,
was saying, if you start criticizing the Mayo Clinic, for instance, we're gonna have
okay.
problems. So I was thinking, I don't need to be censored. I don't need to do this. And the reason I started speaking up in that group is because I saw photo after photo of people going through treatment, but they're drinking like fountain soda. They're
Oh,
eating processed cheese with French
mhm.
fries. They're eating just really, really poor diets, and they're taking photos in between treatments. Their faces were beet red from all the toxins that the doctors were pouring into their body, and I couldn't
Mhm.
bear images after images for several months. So I thought maybe if I make friends with the admin and ask for his permission, can I share some of the books I read? And he at first was like, yeah, that's fine. But then when he started censoring, he or some other admin started censoring me, I said, I'm leaving this group. Sorry, I don't need to spend time here. Then the
Right.
next thing I did was to look for natural support groups that that embrace natural therapies. So I found those groups, and that was a really great avenue because now we had some like-minded people, and I could share so many things, and I could actually practice explaining all the stuff I was learning, and it was like very therapeutic for me to be able to do that. And I met a lot of people through that, and I still have a good friend that I met through that experience. So the support groups were very helpful.
That's wonderful because that's something I did not take advantage of. I wish I did. I don't know how it would have influenced me if I did, but
Mm,
yeah, I've always known that support groups are very helpful when it comes to trying to manage through it all.
mm,
So thank you for that.
sure.
What role did your mindset or spirituality play in your healing journey?
I read a book called The Secret several years ago. Rhonda Byrne was the author. And the message I got reading that book was that all these miraculous stories of individuals, somebody I remember, he crashed a plane and he was pretty
Mm,
much paralyzed, but he told himself, breathe deep, and he walked out of that hospital on his 2 feet and he healed himself. Right? So the
mhm.
understanding I had is that every cell in our body responds to the way we feel. And so when we talk about spirituality, mindset, I always think if we believe that things will be good, everything will respond. And I think The Alchemist is a book that Paulo Coelho wrote. And there's a quote from that book that I love so much. He says, for when you want something so much, all the universe conspires to help make it happen.
Mm,
So if we really, really desire something good, and we really focus on it, I think we end up channeling all those energies. We meet all these people. We start reading all the information that helps us. So I think the mindset, spirituality was super, super important in getting on the path towards healing.
it does. And thank you for saying that because I believe that too. It plays a very vital role. When did you first notice improvements in your health?
Well, we started feeling good right away because we were eating better and sleeping better, and that has a lot of physiological benefit just by getting enough sleep. We wake up, our hormone balance is better. We have less of the hormone that makes us feel hungry. We have more of the hormone that makes us feel full. We're gonna crave less of the things that are bad for us. So right away we feel better. The fasting helps build up our immune system, helps us detoxify our body, and
Mhm.
so we felt the immediate benefits to it. And then since the doctors were doing ultrasounds very, very frequently because they were trying to bring us in and ask us, are you ready to go this surgical route now? Do you want to schedule the surgery now? So they wanted to see us every couple months. And we keep telling them,
Wow.
oh, not yet, not yet. So, but every time we went, the supposed cancerous tumor would not grow. So
Okay.
I'm very disappointed at that point because it didn't shrink the way I wanted it to in a matter of a few weeks. But
Right.
it also wasn't growing at all. So that I think
But not
that
growing is
mm,
progress,
it is progress
right?
because I remember Dr. Frank Schallenberger. He gave a presentation in 2018 at the Riordan IVC and Chronic Diseases Conference, and he was talking about cancer being a problem only if it doesn't stop growing. So if he said if it's not
Mhm.
growing, you could play golf with it, you can do whatever you like as long as it doesn't grow. So, and so
Right.
initially it wasn't growing, so that was very helpful for us. And I guess the biggest turning point, besides my wife losing 30 pounds and me losing 17 pounds, the reason I lost 17 pounds and not 30 is because I had lost 13 pounds the year before doing fasting,
Mhm.
intermittent. I was already doing intermittent fasting every day. I would go on 3-day fast, 4-day fast because I wanted to lose the beer gut that I had accumulated over the
Yeah.
years. And so
Yeah.
we both lost weight. We both started to look better and feel better. So we really enjoyed that part of
Yeah.
the journey.
So you were doing fasting with intermittent fasting.
Right. So I
Yeah.
would do a prolonged fast. I think that 4 days was the max up to that point. I had never gone past 4 days, so that it became a little bit different. I had to be a little more educated on the body and what you need if you're gonna go beyond 4 days. So,
Yes. And that's the thing about fasting because you really need to know your body and the way it
mm,
responds to it
mm-hmm,
before you start incorporating prolonged fast because it can also be very dangerous if it is not done properly. Because I
right.
remember at the time when I my body hadn't become insulin sensitive, when I
Mm,
tried doing prolonged fast, I would get to day 3 and my insulin level will just be dropping like crazy. It would
mm,
just drop to the point where sometimes on day 3, I would check my blood sugar levels and it'll be at a 69 or
mm,
70. And that is very dangerous. So,
yeah,
but then it's changed over time after I became more insulin sensitive. But it is, you said something that I picked up on. It is very amazing how changing few things or little things or changing things one by one in our diet goes a long way, and eating better goes
yeah,
a long way to changing our entire system and composition,
sure.
because great nutrition and feeding your body with the right nutrients that it needs instead of
Mm,
everything man-made
mm,
that quote unquote tastes better, if you
yeah,
think about it that way. If you feed yourself the right nutrition and the right fiber, the healthy fats, the healthy protein, you are better off. And combining it with intermittent fasting or fasting, that blows my mind, the type of effects that it can really have on your body. So
sure.
it's not, sometimes you don't have to go have a big bang. You don't have to go all out and say, okay, I'm cutting this out, cutting this out, cutting this out, and then it's not sustainable. You just have to gradually introduce yourself to it, and it's really amazing because that's what you did. You just
Yeah.
you changed your diet. You introduced intermittent fasting that's similar to what I did,
Mm,
and boom, just like that, in months, the chronic conditions, it just started falling off. Aside that, the weight falls off.
it
It's so
is.
amazing. Wow. So, have you undergone medical tests to confirm remission, and what were the results?
Sure. So, I mean, we've done 6 ultrasounds now since finding out in July 2023, and then we have to go back for another ultrasound in April. Now, the surgeon's super nice. He's agreed to monitor us every so often, but they don't want to
Okay.
see us that often. And then he asked me, if it grows, are you going to do surgery? And I told him yes, because in my mind, we'll never let this grow. So, but
Exactly.
but I have an interesting story because we've been measured 6 times, 5 times at the same hospital, 1 time at a different hospital. So before the sixth scan, we had a fifth scan somewhere else because the chiropractor wanted her to get a X-ray for her back, 'cause she had some back pain. And then when the X-ray results came back, it seemed like there's something near her kidney area.
Okay.
So we went to see a kidney doctor, a nephrologist, and the nephrologist said, "Oh, no, we can do a CT scan tomorrow morning." And I'm like, "Oh, no, 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 that's way too much radiation." Because as I understand from the research, is that a CT scan has like 300 times more radiation than an X-ray, and
Oh,
I'm not gonna subject my wife to that, or she's not gonna subject her body to that. So I asked him, can we do an ultrasound instead? And he said, that's fine. We can do the ultrasound. Then I asked him, can we wait one more week to do it? And he's like, fine. So during the week, we did all kinds of natural remedies, drank a lot of water. We took chanca piedra, which means in Spanish, the stone cracker, stone crusher.
mhm.
Anyways, lemon water, all these things. A week later, she had an ultrasound, no kidney stone whatsoever. But
Wow.
this nephrologist was just a sweet man, and he was so concerned about the diagnosis that she had, and he wanted her to be well, and he also wanted to scan the heart and both breasts to see where she was. Now,
Right.
the radiologist who interpreted that particular scan said they did not find any suspicious masses, meaning to them it looked like a benign tumors.
Okay.
But they did have a disclosure saying that this is not a diagnosis. The only way to really tell is through a biopsy. Please do refer to all previous studies. So I thought it was a little interesting. And then when we had the sixth ultrasound, at the same hospital that did the other four,
Mhm.
they normally measure it three ways. So they plot it
Okay.
manually from point A to point B, three different diagonal lines. And the sixth time they measured it a little bit differently. They only plotted it with two diagonal lines. And the thing
Wow.
is, it came out being a little bit smaller. And I'm thinking, okay, it's like half a millimeter smaller or 0.2 millimeters smaller this way, but it's still smaller to me. But
Right.
now, what these technicians and doctors are saying are, well, an ultrasound, when we plot the size of a tumor, it's user dependent. I think it's the term they use, the phrase user dependent, meaning a human being looks at the screen and plots from point A to point B with the mouse pretty much and measures it.
Okay.
So, depending on how that person clicks, it could be a little bit smaller or bigger. So just because you have a slight change doesn't necessarily mean that it's meaningful. And so that's the way it was explained to us. And I understand that, but how come the other times we measured it, it was almost always the same? And this
Right.
one time it's slightly smaller. And the one time it's slightly smaller, this is the only time they're measuring it with two diagonal lines instead of three. They didn't want to measure it the other way. And then I also asked, why is the shape different now in the scans than before? And the surgeon looked at it, compared, and said, it does look a little different now. I can see why the other hospital may have said that it looks non-suspicious. The only way for us to know for sure is to have another needle biopsy. Where I'm going with this is I'm trying to say that maybe the body has some physiological change where
Mhm.
things could be improving. Who knows? I mean, I have my own ideas, but I don't want to come out and say too many things. But there's a lot of research on that aspect too that people could do if they wanted to.
Wow. So looking back, would you do anything differently?
Yeah, I mean, hindsight is 2020. So what would I do differently? Maybe I would have gotten on hydrogen inhalation quicker because that's something I did at the
Okay.
back end. I didn't know about it till
Okay.
a few months ago, and I didn't realize that it is so effective. And there's so many studies on that too, over 170 disease models, over 1,700 studies, and there's been a great deal of success using hydrogen inhalation.
Okay.
And because hydrogen is the smallest molecule in the universe, it can really get deep into our body and help us heal. So maybe I would have jumped on that quicker.
So what does that do? What is it? Hydrogen inhalation or infusion?
Yes, it's an inhalation, so it's
Okay.
combining two parts hydrogen with one part oxygen. So it's called hydroxy. And
Okay.
we inhale that, and it helps heal the body at the molecular level. And there's been a lot of success for people because it crosses the blood-brain barrier. The people who have glioblastoma, brain tumors, they've had
Hmm.
success. But usually, the studies show that it takes about 3 to 6 hours of inhalation a day, and a person probably should be doing it for about 6 months before they start to see real
Okay,
results.
so pardon my ignorance here,
Hmm.
but is two parts hydrogen and one part oxygen water?
I guess I don't know. So
Oh wow.
we
So
pour distilled water into the machine, and
uh-huh.
then there are three different spouts. Two parts are hydrogen, one part is oxygen. Then they come together, and then we use a nasal cannula, and then we breathe it in. And the
Okay.
machines are very, very expensive. There
Wow.
are machines and companies in the US that sell them,
Mhm.
and there are companies abroad that sell them as well. But the studies use, I think, what they call 3,000 milliliters per minute is the level that they felt was the most effective.
Wow, that is fascinating. But what advice would you give others
Mhm.
exploring alternative treatments?
Don't lose any hope. There's a
Hmm.
lot out there. This isn't hocus pocus. So many renowned scientists and doctors who've gone above and beyond their call of duty have done so many amazing things. They've risked their medical license on the line to go against the grain to produce research without funding from pharmaceutical companies. They've managed to come up with so much evidence on natural things that could help the body, where there's not a lot of opportunity to profit because if you take a natural compound like ginger and you extract ginger critical extract, and we find that it's really good at healing, you can't
Hmm.
patent that. So we can't turn it into a drug. So there's no money for that. So there's not going to be a lot of funding. But somehow these people managed to get these studies done.
Yeah.
And of course, it's not going to be a full-blown clinical study where it's double-blind, where neither the doctor nor or the patient knows what they're receiving,
Mhm.
because that's so expensive. It takes tens of millions of dollars to do that. So these would be smaller scale studies, but people have done it. And so just know that if you're willing to know the truth and you want to follow the evidence, it's there. So I would suggest follow the evidence and see where it takes you.
That's right. And I totally agree. How has surviving cancer changed your outlook on life?
I would say that it's strengthened my belief that positivity is a wonderful thing. That if you believe that things could be better, that you can be better as a human being, and that we're
Yeah.
all interconnected and that everything is interconnected, the
Mhm.
possibilities are limitless.
That's right. And I totally support you on that with positivity because naturally I tend to unintentionally I run away from people who are negative
Hmm.
and very skeptical about a lot of things. So when I realize that you are very negative about a lot of things or not a very positive person, it's very difficult for me to get close to you because I try to be as positive as I can, and positive energy has a lot of effect on a person no matter who you are. So yeah, definitely staying positive. I totally agree with you on that. It's just being determined and being positive and knowing what direction you want to go, where you want to go,
Right,
how you want to go, what you want to accomplish. And you just veer into your spirituality, your emotions, your mindset, your mental capabilities. It's amazing how far it can take you.
sure.
So, thank you for saying that. Do you continue to follow certain natural remedies or lifestyle habits?
Yeah, absolutely. I mean, it's changed the way that we live day to day. It's changed the kind of things that we eat. It's
Mhm.
changed the way we prepare food or consume food.
Mm,
And because I become so much more aware of things that cause sickness, I am able to live a healthier lifestyle. I mean,
yeah.
just an example, me going into work every day, I get on the elevator, I see a person drinking out of a plastic container with the plastic straw. Now, we do this every single day for several decades, not realizing there are forever chemicals and bisphenol A or bisphenol S in that plastic container. We don't think twice about it, but our body was not designed to be consuming those kind of chemicals. So that right there on the elevator, I say, okay, this person's putting chemicals in their body. Now I go to the office and then I get a cup of coffee in the kitchen. And then people are making the coffee with powdered drinks, powdered dairy products, like chemicals, all kinds of chemicals. They're putting it in their body and they're wondering why they're limping around and why they have inflammation. So I notice things more and more. And then as I'm getting my cup of coffee, maybe someone's putting a container of food in the microwave and running it, but that container is plastic and you're heating it up with radiation in a sense. Well, non-ionizing radiation. A lot of scientists say, oh, the microwave is safe, but if you do your research on it, probably isn't very safe. And they're heating up food. There's no nutrients in that food, where it's very little nutrients when we heat it up in the microwave. It's harming our body. And the person not only has it in a plastic container, but they have a plastic bag that's covering up the plastic container. And so they're heating that up. And I think, okay, so these are some of the things that I don't do. And they say the average female consumes 150 different chemicals per day in her body from just living day to day. The average man about 100 chemicals, because maybe men use less products. They don't wear the mascara and all these things that
Mhm.
and even the bra that women use, it's the foam. There's chemicals that go into that as well.
Okay, one,
Mm,
I have
mm,
so many questions. You
mm,
going
mm,
down this rabbit hole because,
mm,
okay, first of all, because
mm,
we have to wear bras. We can't walk
mhm,
about braless, you know? So, and just to take you back a
mhm,
little, you spoke about plastic containers and a
mhm,
plastic straw.
mhm,
Now, and the microwave, that's something I'm guilty of because in current day,
mhm,
you can, especially when you're trying to make a lifestyle easy and sustainable, it's really difficult to stay away from these things. So,
yeah.
what would you recommend? So, if not a because I have a plastic cup and a plastic straw right here.
Right.
that I don't know if you see it, that I'm drinking
Yeah.
my water from. So
Right.
what do we use? If you know, or
So,
do we reduce the
mhm,
plastic that we use, or do we not use it at all? Or what is the recommendation? Because as you were speaking, I'm like, okay, yeah, there were several light bulbs coming on because I use the microwave a lot. Number one, for
yeah.
convenience,
Mhm.
right? I use plastic, especially with cups and water. And because if I'm outside and I'm thirsty, I'll drink from a plastic bottle.
Right.
So,
So,
what are the other options? What can we do differently that can be sustainable and
sure.
easy just to fit
So,
into our current lifestyles?
I think that somebody tried to live a plastic-free life. I was reading a book and it gave an example. A person said, "I'm not going to use any plastic." And then they soon found out that it was impossible to avoid using plastic because everything is wrapped in plastic. So,
Right.
what can we do? So, an example is instead of buying a plastic bottle of water to drink, maybe we can buy something in a glass container. Like I have this one here, glass container,
Okay.
and drink out of the glass container. Now, if you notice, the glass container has a cap and it's an aluminum cap,
Hmm.
which is known to be a neurotoxin. Plus, the
Right.
lining underneath is gonna have BPA, so it's not perfect. But what did I do here by choosing to drink out of a glass bottle? I've minimized the level of toxins that I'm pouring in my body for today by using a glass container as opposed to a plastic container. So that's a little thing that we can do, an adjustment.
Okay.
The other thing that we can do is, well, we use something called a reverse osmosis filtration system at home. So what that does is to remove the fluoride from the water.
Hmm.
And that's another way to stay healthier. Now, the FDA has never once approved the fluoridation of municipal water, but it's been done in the US and parts of the world for many, 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 many years. And there are studies that show communities that have fluoridated water has more instances of sickness compared to the ones that don't. So, and we do know that fluoride is a neurotoxin as well. But what do? We use a fluoride toothpaste. We drink tap water full of fluoride. These
Hmm.
things are not really helpful. And the studies and evidence also shows that fluoride doesn't strengthen teeth. It actually may be weakening teeth and causing cavities. So that makes sense to me
Mm.
intuitively. Using a fluoride toothpaste 2, 3 times a day, we go to the dentist and we have cavities. Why is that happening? Right? So
Right.
we switched over to nanohydroxyhapatite, which helps remineralize the teeth. Now, finding toothpaste that doesn't have the chemicals that you may not want is almost impossible. It's almost like you have to make your own toothpaste somehow. But I did settle on something with the ingredients that I wanted. So those are kind of things. The water that we drink, the containers that we eat out of. We got rid of our microwave. I mean, we still have one in the kitchen, but we don't
So,
use that
so
microwave.
what do you use? You just heat on the stove.
So, I mean, a lot of that came from me reading books written by Raymond Francis, who's an MIT graduate and a chemist by training. So, what he did was in his three different books, try to reverse engineer disease and try to simplify it. And he was talking about all these different pathways that lead us to disease. And then if we go backwards from that, it leads us to health. And
Mm.
toxicity was a big topic. And he presented evidence and studies on the microwave energy and then the cookware, he talked about don't use anything that's Teflon coated. Like the Teflon done, like it doesn't
Right.
stick to Teflon, like frying pans have Teflon coatings. They're actually very, very
Wow.
toxic, and we're heating up our food using Teflon. So we want to switch over to ceramic coated, or maybe stainless steel at the very least. We can use like Corningware, glassware. That's all reasonable. But
Okay.
aluminum cookware, definitely no. Aluminum kettles, definitely no. And I think that I actually had an aluminum kettle for years. I don't know if it was aluminum because after I got married, we threw
Look,
it
I
out.
have an aluminum kettle right now.
Okay, okay. So, when I remember I moved to New York from Massachusetts, and then I was single, living by myself, and my friend drove me to IKEA, and I just bought stuff that I needed. And one of the items I picked up was a kettle. And I used that
Mhm.
kettle for a long time, but I remember whenever I had that kettle, I was always sick. I was sick all
Mm.
the time. I had diarrhea once a week. It was just a natural part of life. until I started taking prebiotics with the probiotics. Then I started getting better. And then when we got rid of that aluminum kettle, I think it was aluminum, I didn't have these problems anymore. So another example, I used to, when I was single, heat up water in that kettle. I would make instant ramen noodles,
Mhm.
which is in a styrofoam container. So
Yeah.
imagine I'm pouring boiling hot water into a styrofoam container with all these chemicals that are now being released, not just from the kettle, from the aluminum to the water, but then the water's releasing more chemicals from the styrofoam. And this is what I'm eating after a night of drinking when I was single. The next morning when I feel hungover, one of my favorite things to consume was instant noodles with some Tabasco sauce. So that couldn't have been good for my body. And once I cut these things out of my lifestyle, I've been getting much, much healthier and I have more energy to do things.
Man, now that you have explained it like that, because if you're pouring hot water onto your instant noodles, it's such a simple process.
Hmm.
But as you were talking about it, it's like, man, that is not good. Even though
Right.
it's such a simple process, this is mind blowing, mind boggling. And I believe that if we go down this rabbit hole, we can
Hmm.
talk about it for hours.
I don't
But
mind. So.
yeah, yeah, I think I'll definitely have you back so that you
Mhm.
talk more about that because I believe very strongly that a lot of chronic diseases and diseases come from the toxins that go into our body. But because of our very fast and easy lifestyles and way of life, it's become very normal. Everything has
Yes.
been normalized to the
Hmm.
point where we don't realize that it's even a problem. And you can actually be solving one chronic disease and packing on another, which is mind blowing to me. There is a lot when it comes to toxins that we are unaware of or that we don't pay attention to that we introduce into our body every day.
Yes.
Wow. So, how has your story, with everything that you've gone through,
Mm.
how has your story influenced those around you?
I think close friends are very, very supportive of what we're doing. They like to hear good news. Some of
Yeah.
them, they're kind of rooting for me. Some of them might be
Mhm.
skeptic, but when I share good news, they're very happy. Even though
Yeah.
they're afraid to try it themselves, they
Hmm.
may have chosen to do things their way, the conventional
Hmm.
route. They still want to see me succeed and my wife succeed
Yeah,
because they feel like maybe they'll do that one day if they see some evidence. So
that's
that's
right. And I believe that's how it is. Many a time when you're going through that journey, onlookers would be skeptical and they would wonder, oh my goodness, what are they doing? Is she crazy or is he crazy? How is that going to work? But when they start seeing the positive results, they also want to try it because I believe everybody is looking for a change. The only thing is that the kind of change that is given
mm,
sometimes doesn't always help. So
sure.
everybody wants to find a way that is, I believe, well, some people, not everybody, some people want to find a way that is natural that they can actually use to help better themselves, their lifestyle, their health, and everything else.
Mm,
So, were there moments
mm.
when you considered combining natural remedies and conventional remedies, treatments, even though you have mentioned that, yes, you didn't want to go through the surgery, you didn't want to do everything that was being recommended by medical professionals, but were there moments during the journey where it got so difficult that you thought, ah, maybe I should just combine? I mean, a little wouldn't hurt. Combine natural and remedies with conventional treatments.
You read my mind because that's where I was going next. So, yes, in the very beginning, I thought, couldn't we just get the surgery, excise the tumor, and then do all these natural therapies to help,
Right.
right? But
Mm-hmm.
there's a good reason why I decided not to do that, and that's what I wanted to talk about. So, that
Okay.
very first book I read that cites 2,300 scientific studies and clinical trials. It talks about the tumor microenvironment and what surgical stress does to that environment. So I'm just gonna read off a few things, and the audience might not know what everything is, neither do I, but if you just listen to it, surgical stress increases free radicals.
Mm-hmm.
It increases tumor necrosis factor alpha. This is what makes the tumor cells die off too quickly, and then it's gonna harm adjacent organs. We don't want that to happen. It increases interleukin 1 beta, interleukin 4, 6, and 8, nuclear factor kappa B. It increases cortisol, adrenaline, prolactin, vascular endothelial growth factor, epidermal growth factor, nitric oxide, lactic acid, estrogen, prostaglandins, serotonin, and histamine. And so in this book, it talks about all these studies that are cited and the 16 different ways that surgery causes cancer. So when I read all of that and saw all that evidence, I decided, no, 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 we're not doing any surgery. And so those are some of the
Yeah.
reasons. The other book that I read by Raymond Francis, the way he explained it is you should be glad you have a little tumor there because now the
Oh, wow.
the thing is, doctors think of the tumor and they're so good at trying to focus on a symptom, they convince themselves the symptom is the disease. Instead of like when you have high blood pressure or diabetes, there's a systemic issue going on in the body that's causing these issues to happen. Instead of treating the underlying cause, they give us a pill or they give us injections. And likewise for cancer, when you have a tumor, which is a manifestation of something that's happening in the body, they think that if we take that tumor out, we're solving the problem. And there is the fallacy. Because
Mhm.
once you remove that tumor, a surgeon will always say, we got all of it. But there are billions of cancer cells in the tiny little bit of that tumor, and it is going to spread. And studies show that even a needle biopsy increases the chance of spreading.
Can it regrow?
Of course, because we see this all the time. I met a lady that summer. She was telling me her story about how she was diagnosed with thyroid cancer, and she asked the surgeon why didn't they do a biopsy, and the surgeon said, "I'll do the biopsy on the day of the cancer." Really, that sounds
Wow.
very strange to me. So she had the surgery where they took half of it out, and then they told her to get a second opinion. And she's like, I don't need a second opinion, take all of it out. So she removed the entire thyroid and then she was diagnosed with cervical cancer. So she had surgery and radiation and chemo and all of that there as well. Then she had breast cancer. And
Wow.
then recently she's had another breast cancer diagnosis. And so her friends think it was just, I don't really want to go there, but they think that the vaccine that she took was the primary cause of the recurrence. Now, I don't want to talk about that topic because we can if we want to go there a different day, but it's not really the point of my story. The point of my story is
Right.
that when we go to a doctor, they give us these statistics, 5-year survival rates. They're using a 5-year period where they monitor the patient. And as long as the person doesn't have another diagnosis during that time, or if they're alive for the 5 years, this is considered a 100% success rate. So
Mhm.
if a person gets diagnosed, has the tumor removed, or maybe they use chemo to shrink it first, then they remove it, and then they do the radiation, and for 5 years we don't have a recurrence, that's considered a 100% cure rate. If one day after the lady gets another diagnosis, it's not counted as a recurrence. I mean, they would count it as a
Mhm.
recurrence if it happened in the same spot, and it happens a lot. It's the same spot or very close to the same spot. But if it happens in another part of the body, let's say the person had a breast cancer and they had everything removed and treated, then they have cervical cancer, it's considered a whole new disease.
Oh, wow.
And the reason why it's good
I know
to have a
that.
tumor, according to Raymond Francis, is because your body has decided, oh, here's the problem. And the cancer cells have made a home in that tumor. We know where they are. This is where they're
Mhm.
living. If we burn down their home and they start going all over your body trying to find a new home, we don't know when they're going to come back, where they're going to
Right.
come back, and how serious it's going to be. So we might as well have it there so it's localized. And so this way I can monitor, is it shrinking? How much is it shrinking? So that I
Mhm.
think is a better approach than cutting it out. And then
Yeah.
the other thing is that the gentleman said that if she has the tumor removed, her breast will never function the way it was meant to function. And
Oh.
so if she wanted to have a baby and breastfeed the baby with that particular breast, she wouldn't be able to. And
Mhm.
I'm gonna say this, I am Christian, I believe in God, and I believe that
Yeah.
God
Yeah.
didn't he did not design us in a flawed way. He designed us perfectly in his image, and everything that's in our body has a purpose. And if we think that we can just remove the adenoids or the tonsils, it's like saying, well, I might hurt my finger one day using a hammer. I should cut my fingers off so that it would never be broken. So I think it's very arrogant for us to think we could cut things out and fix things by cutting things out.
Yeah, because God put everything in your body for a reason.
Yeah.
So the more you cut out, the more you alter your body the more you change it, and it will never function the same again.
Right.
It's just amazing how you can, what do you call it?
Mm.
Cancer in remission or reversal, or what do you call it?
So I want to talk about that word remission. I think it's very, very
Okay.
important. I don't use that word remission. I will never use that word remission because when we talk about remission for cancer, doctors understand that it's not over. They've done what they
Mhm.
can to the best of their knowledge based on the data that they have. If they excise the tumor, they radiate the tumor, the chances of it coming back within 5 years, if they minimized it, they figured it's in remission, meaning it's kind of like a ceasefire agreement. If
Right.
there's a
It's like it's
war,
on hold.
it's on hold. It's not resolved. It's a They know this because science shows when we do treat it conventionally that the daughter cells of the cancer do die and shrink in a lot of instances. However, the stem cells, the cancer stem cells are very, very smart and they adapt very quickly and they can
Mhm.
come back stronger. So chemotherapy, the reason that it works to an extent is because it's killing off everything in the body, good cells, bad cells, whatever it is. And then the reason we lose our hair is because it goes after the most rapidly dividing cells, the ones that are moving fast enough. So hair cells divide very rapidly. So that's why we lose hair when we do chemotherapy. But as it's killing off
Mhm.
the good cells and the bad cells, the cancer stem cells are adapting to it and going, oh, I gotta figure out how I can become resistant to it. So that's why sometimes people use all different types of chemotherapy agents. And at a certain
Mhm.
point, they have something called MDR, is multi-drug resistance. And then the chemo doesn't work anymore. And then the doctor says to go get your affairs in order and they send them home. And so uh,
Wow.
I don't I don't use remission because I don't want a remission of cancer. I want the body to heal itself so that we don't have a remission. So there's no recurrence. As long as we maintain a healthy lifestyle, we should never be sick again. That's the idea
That's
behind
right.
it. Hmm.
That's right. So it's a reversal and it's done and that's
Mm,
it. Right.
yes.
So when you were speaking, I thought of something when you
Mm,
mentioned chemotherapy. So basically, chemo is killing all the good cells and the bad cells, but then it kills the cells to the point where, because the bad cells are a little weak, it kills the bad cells off, but then it still kills the good cells off to the just to the point where it would not die, but then the bad cells are killed off and then the good cells can gradually revive.
well, no, they kills both. The good cells and the cancer cells and the healthy cells, they're both killed off. But the cancer stem
Totally.
cells, yes, it's
Wow.
inorganic, doesn't know the difference, doesn't know to differentiate, so it just kills everything in its path. But the cancer
Mm.
stem cells do not get touched at all. The cancer stem cells survive. They're very strong. There's no chemotherapeutic agent out there that's been proven to kill a cancer stem cell. And the
Wow.
doctors know this, or maybe they choose not to look at that, but that is the scientific fact. And that's why
Okay.
we have recurrence because the stem cells come back. But the
Wow.
funny thing is, research shows that natural strategies, such as ginger or sick shogahol, is a different way to extract the ginger by using heat. It kills off the cancer stem cells. So we can take green
Wow.
tea, we can take ginger, we can take garlic. These things kill cancer stem cells.
Things as simple as ginger and garlic.
Yes, and green tea,
Wow.
EGCG in the garlic in the green tea. So we have so many natural things that we can use that actually have been proven to kill cancer stem cells, yet we refuse to use it. So a really good book is called Natural Strategies for Cancer Patients. It's written by Russell Blaylock. He was a neurosurgeon and not an oncologist, but he had to help people with brain tumors. And for some reason, this gentleman did so much research and so many studies, and he wrote about all these natural ingredients that help the body. And it was such a good book. The font is a little small, so I listened to the audiobook. And
Yeah.
then I got the paperback so I can go back and references. But he mentions so many natural ingredients that we can use, and I
Mhm.
used just about all of them. He's like, you don't have to use all of them because
Right.
there's a recurring theme. They all kind of work similarly to each other, and some of them are
Mhm.
synergistic, like the quercetin in onions, also in apples. They help kill cancer
I
stem
love
cells.
onions. Like
Right.
all these things you're mentioning, it's just lighting me up because onions, garlic, ginger, they're things that I add to my meals every day.
Sure. I did want to talk about chemotherapy as well, because people think, why wouldn't you just do something like that when it's very quick and effective? We have
Mhm.
to recognize where the chemotherapy comes from. A
Mhm.
lot of it today, and if people don't believe me, if they're listening, you can Google it and use a tool called Google. Be my guest. But a lot of it comes from the mustard gas agents, and mustard gas was a biological weapon used throughout up to World War II, in World War II, and then the world's governments came to an agreement never to use this particular biological weapon ever again in warfare. Then there was a lot of research being done to see can we use it in medicine for something. And so there was some inclination to go that way. And then there was a lab accident where we had spillage of the chemical, and some of the people exposed, they had shrunken lymph nodes. And so that was
Mhm.
kind of the tipping point where it started to be used in the practice of medicine for cancer care. So, what are we doing when we use chemotherapy? We're putting toxins into the body. So, with all the research that I've done, all the authors that I read, and I continue to do, now I have more of a simplified way of describing cancer itself. It's really the result of too much toxins in the body. And when we have too much toxins in the body, it weakens our immune system. And then when we have too much toxins in the body, a weakened immune system, then we have a greater nutritional deficiency. And when you combine the three things, and then you have pathogens that come in the body, that we all have parasites in the body from normal diet. We have bacteria, viruses coming into our body every single day. But it's almost like a perfect storm where all these things are going wrong, and then you're having a really bad um, diet and lifestyle. You don't get enough sleep either. You have so much stress. You take too many prescription medication because your doctor told you you got
Mhm.
to take this pill for the diabetes and high
Mhm.
blood pressure, and all of these toxins build up. And so the manifestation of that is cellular malfunction, which is what Raymond Francis described. We actually he describes it as having one disease. Um,
Right.
whether it's a viral infection, a bacterial flare up, whether it's a tumor, it's just a cellular malfunction. If we have Parkinson's, it's cellular malfunction of the part of the brain that has to do with memory. If it's Parkinson's disease instead of Alzheimer's, I'm sorry, Parkinson's disease is affecting the cells of the brain that produce BDNF for our autonomous functions, automatic functions.
Mhm.
And so on and so on. So it's really just trying to make sure we don't have cellular malfunction. So
Wow. And just to put it out there, I know some will say, well, there have been some people who have used chemotherapy and it's worked for them. We are not saying nobody should use chemotherapy. All we are saying is if you have the option of using natural remedies and it's not far gone where you absolutely have to resort to that, natural remedies is an option too. So
sure.
what would you say to skeptics of
Mm.
natural remedies?
Well, I don't know what to say to the skeptics because the skeptic is always a skeptic. So
Right.
I mean, I have a good friend. He's a skeptic, I think, and he's gone through chemo. Now he wants to lose weight
Mhm.
and he wants to take Ozempic. And
Wow.
so I thought, oh, you know what? If you want to become healthy, maybe you want to try all these natural things to help you curb appetite and lose weight, the kind of how my wife and I lost all this weight.
Especially after going through chemo.
And then I shared some of the side effects of Ozempic, known side effects of Ozempic, like pancreatitis, kidney failure. Thyroid cancer was one of them, but it said that if your family has a history of thyroid cancer, this could happen. So, but when I read that, the way I understand cancer is just cellular malfunction. It's a manifestation of too much toxicity in the body. So, if we just put a lot of
Mm.
toxins in the body and now our immune system is weaker, our nutritional deficiency is greater than before, I think that to me explains why people have recurrences because the body is in a worse state than it was before. And this is from Ty Bollinger's book, The Truth About Cancer, the way he describes it. It's setting the body up to be more sick. And actually, I
Mm.
think Chris Wark in Chris Beats Cancer always also talks about it that way too. If you do all this to the body, you make it weaker. What do you expect to happen in the future?
Right.
And in my mind, this is why people keep getting re-diagnosed. Now, I also want to say everybody makes a personal choice, so I don't mean to come here and say don't do this, don't do that. I'm just sharing what I have chosen to do and what
Mm.
my wife and I have chosen to do on our personal journey. We've decided based on some of the evidence that we believe chemo is not good for us. So we're not going to do it.
I'm so blown
Mm,
away by your story, and thank you so much for sharing your story. Do you have any last words for our audience?
Keep your hope. There's a lot of evidence. I didn't have enough time to go over all the things that I wanted to talk about today,
Oh, we will
but
have another session
okay.
because I need to know more.
Sure, but there is just so much to talk about. And I guess what I want to say is that we don't want to complicate things. Disease, from what I have learned, is just a manifestation of too much poison in the body to weaken immune system and nutritional deficiency. So if we address our lifestyle, diet and lifestyle, I think we can solve a lot of things. And you had shared your journey about the herniated discs and also the diabetes. I also did a
And
lot of
high blood
research
pressure.
and high
High
blood pressure.
blood pressure.
And I could talk about high blood pressure and diabetes for an hour as well, because to me, it's the same problem. They're all related to each other. Like Alzheimer's is called diabetes type 3. It's the inability for us to
Yeah,
process the excess blood sugar in the brain. So,
yeah. It blew my mind. I read that
mm,
a few weeks ago and I
mm,
was like, wow.
so I,
Diabetes type 3. They just, I believe, reclassified it as diabetes type 3.
right.
That blew my mind.
Sure. And I think the things, why does fasting help diabetes? Why does it help a cancer patient? Because it's the same body system. We're all the same. We're all designed in the same way. The body works in a certain way. So if we help the body heal, it's going to do better. Now everybody likes to say, oh, we're all different. Everybody's different. You got to listen to your body. Yes, it's true. We might all look a little different. We might have different hair. Like maybe I have straight hair, you have curly hair. Maybe my melanin in my skin is not as much as somebody else. And we have slight differences, adaptations. But if we were all so different, we would not be able to treat the body. If we had a heart in a different spot, if our lungs I had two lungs and you had one lung, and maybe I have three lobes on this side and you have one and a half on the other side. If you had one kidney and I had three and a half kidneys, we wouldn't know what to do with ourselves. But it's
Right.
because we're designed in a way that are so similar that we are all the same in the sense that we can even begin to figure out how everything works and how we can make it better.
That is so fascinating to know that the same lifestyle changes and diet changes and just living a much healthier lifestyle and nutrition, managing your stress, your sleep, not putting toxic chemicals into your body,
Mm.
smoking, drinking alike, makeup. I have
Yeah.
makeup on right now.
Yes.
So when you said that, I was like, oh my gosh.
Mm.
So, putting makeup on our faces, our lips, our eyes, and drinking out of plastic bottles. It's amazing how society today has changed our lifestyle and
Mm.
the way that we do things, unfortunately, to the detriment of ourselves.
Yeah.
One, thank you so much for joining us. I really do appreciate it. I can't wait to talk about all these other topics that you are
Mm.
so knowledgeable about.
Mhm.
I can't wait to talk to you next time. So,
Mhm.
thank you so much for joining us.
My pleasure. Thank you for having me.